Hey guys, Tony here. So it's that time again. Surgeries are starting to be scheduled again. You guys are getting back on the books, getting ready to have your knee replaced. And a couple questions you're gonna have is, what do I do in those first couple days? How do I manage the pain? How do I manage positioning? What do I do when I get home? Let's touch on a couple of the key topics. I'm gonna give you two of my favorite positions and exercises to start doing from day one as soon as you get home, and what you can look to expect during that time. So first, positioning. The most important thing you're gonna face when dealing with a knee replacement is we wanna get the extension first. It used to be before you left the hospital, you would be at 90 degrees of flexion and full extension. Now with surgeries becoming more day procedures, no overnight stays, the therapist doesn't have the luxury of getting the range of motion they need before you're on your way home. So let's talk about what happens when you get home. In an ideal situation, assuming you probably don't have a bench, but what this would be is this is your couch. So if you can imagine, this is my couch, I'm sitting, the backrest of the couch is behind me, the armrest is here, I've got two more cushions, and then down at that end is the other armrest. I turn sideways, and what I do, most of you are gonna feel most comfortable with a pillow under the knee. Whether you're in a recliner or sitting sideways on the couch, this is gonna be your preferred position because the knee is gonna be swollen, it just had surgery, it's gonna be uncomfortable. But truthfully, what you would wanna do is have the pillow down at the other end under the heel so that there's just a little bit of suspension under the knee. If one pillow isn't tall enough, you can fold it over to hit a second, like a 2-layer pillow. And now you won't be able to see it on the video, but there is space between the back of my knee and the couch or the surface I'm sitting on. If this becomes just unbearable, you just can't tolerate it, bring the pillow in, and as you continue to bring it in, this would be zero stretch. There's no benefit to this position other than rest. But if it's on, midway down the calf, you're gonna be at like 50% of extension. If it's all the way at the heel, we're getting the maximum extension force through it. So you just have to do what you can tolerate. I'm not telling you to push through the pain. A little bit of discomfort is okay. Pain, outright pain, is not gonna help you. That's not beneficial. So find some sort of compromise. The second part that I'm gonna recommend, and this is really something that has just completely revolutionized the way I treat patients, probably for the last 15 years, is a simple rolling pin. One of the biggest issues that happen within the first couple days to a week post-op is the swelling, the pain, the discomfort in the knee, but then also is the discomfort in the thigh and the calf, the muscles above and below where the surgery was. Now, logically, you understand there was no direct tissue trauma to the thigh associated with the knee surgery. Some surgeons will use a tourniquet. In that case, there is going to be some damage and bruising to the musculature around the upper leg. But essentially what's going on above it is more what we would call a secondary trauma. Pain, discomfort, secondary to the surgery that was done at the knee. So a simple rolling pin really is the most effective way to start to manage some of the swelling, some of the pain. And typically what I do is, again, I recommend the knee up on the couch. If you can't tolerate full extension, you could put a little cushion under the knee just to give you some temporary relief. You could use a wooden rolling pin, a metal rolling pin, marble, anything you have. But basically what you're gonna do is you're gonna apply medium to gentle pressure all around the top of the leg. You're gonna work on the outer thigh, the top of the thigh, the inner thigh, anywhere that you can reach. And what we're doing is we're applying pressure from low to high. We're trying to create something of a vacuum effect to allow the lymphatic drainage, to allow the fluid to move back into the system, to be processed and improve the circulation at the knee. Once you've done, usually we say between 2 to 3 minutes above the leg, then typically what we're gonna do is we'll put the leg on the floor. If you are able to reach and you don't have any spinal issues or any other concerns, we'll massage the calf and the lower leg. And again, I'm going from low to high. I'm pulling against the musculature. We know that the muscles may be tender, sore, painful, but there's little to no risk of any kind of tissue damage or harm. Now, the big concern is always a blood clot, and this will help you identify if there's significant, just major pain with the pressure of this. That would be something to talk to your physician or your physical therapist about, because certainly we don't want you to develop a blood clot, and the most common signs and symptoms associated with that would be more than usual or increased swelling, redness, hotness, warmth to the touch, and then pain with pressure or squeezing the calf muscle. So a couple of things for you to consider. Finally, bonus tip, if you're at home and you're just absolutely struggling with getting the leg up and back down, certainly a strap like this, and I'll put a link to some of these products in the video description below. A non-stretchy strap around the foot will help you lift it into bed, take it back out of bed, but then also in this position, it'll help you to dorsiflex, what we call pulling the ankle back, so that we're creating a little bit of pull through the back of the knee. Guys, the whole idea in the first couple days post-op is to recover. That's what we're looking for. Get adequate nutrition, get adequate hydration, get the best sleep you possibly can, because the road ahead will be challenging. And if you give your body that 24, 48, 72-hour period to recover, to start the healing process, you will be prepared for the challenges as they arrive. So don't hit the ground running, pun intended. Take your time. Talk to your surgical team, talk to your physical therapy team, make sure you're all on the same page. And if you have questions, do me a favor, post them in the comments below. Put your questions on this video so that I can produce more content specifically answering the questions you guys have. As always, guys, I appreciate your time. Subscribe to the channel, support us, and I'll see you on the next video.